Testing, working? Hopefully working. Is it working now? Okay, perfect. Thanks so much for sticking on there. Okay, so I was saying that actually, that I'm going to keep this more as like an open forum here tonight. And we'll just kind of mostly, I just had this just to showcase one of my favorite patients. She comes on here sometimes. And she got to achieve pretty close to what she was trying to achieve for her skin. And it's awesome. And it's really nice to be able to get that over the course of the last few years. And it's, something that I know a lot of people try to say, can you get close to scarless? It's pretty close to scarless. There's like a little bit, so that's still like some texture that's still there. There's still a little bit of, a little mild pigmentation. She actually has some rosacea as well. And I had to use the XLV laser to help with her rosacea too. And that helped a lot. You can see that redness calmed down a lot there too. So it's nice that we actually were able to solve a few different things over here for this particular patient. Worked on her ice pick scars, those thick elements, those thick scars right there on the side. Worked on all that as well. And you can see significant improvement there. What treatment is this? This was actually a few things. We didn't go crazy aggressive in this patient. She just didn't have much downtime, so I did multiple sessions for her. I did TCA Cross. I did erbium laser. I also did the Bellafill as well. I did XLV as well. So basically I did a few different things. And like some spots, I did some subcision as well for her. So I had to break up some of that scar tissue that's kind of like along the nasolabial fold. I had to break that up as well. Which are the scars that are like dense? So you're talking like atrophic scars. There could be like Boxcar scars, like wider ones, or like those little ice pick scars. Those are potentially what I'm thinking you're talking about. Otherwise, sometimes there's also, if you lose a little bit of volume and it's like just pulled in and stuck, that's more like a rolling scar over there. So it depends on what you're referring to by dense. Like there's a lot of different options for atrophic scars. In this case, for this patient, you can see she has these little Boxcar scars. Those are little wider scars. She has those tiny little ice pick scars scattered around there. And then she has these thick edges of the scar. And that's the thing that I focus a lot on. I focus a lot on those thick edges because I want to make sure that when we're working on these scars, we could make it feel as smooth as possible. So I sometimes just trace along the edges of those scars to do that. So it worked out really, really well for her. And I don't have to do that like over and over and over again with that CO2 laser. For some pockets like that, I try to just do it like really meticulously. Sometimes I just go like 1 millimeter or so and just really that spot size and just keep on smoothing down those thick elements. And that's why it looks a lot softer right there, which, really, really helpful because over time you want to make it so that you can make the skin feel like it's softer, more youthful there. Smiley face is saying, I'm on Accutane for the second time and my doctor says I don't do anything after. What do you suggest? That's not really true, really. You could do Accutane while doing these treatments. In fact, sometimes if you're on like a low dose of Accutane, it may be a good idea because we are suppressing that oil production and you could actually stimulate more collagen. You could prevent future acne as well when you're doing these treatments. So it depends on what kind of treatments you're trying to do, like how ablative you're trying to go, etc. But you could do almost all of these treatments with that. Thoughts on microneedling for minor acne scars. So this patient, she did a lot of Fraxel, did a lot of microneedling. She did not have much improvement. She said there was some improvement. She did say there was some improvement, but it wasn't where she wanted to get to. So it wasn't until I worked on her redness. So part of this is just that like this, the rosacea is inflammatory. So I wanted to calm that down as well. Something like microneedling could exacerbate rosacea sometimes. So I wouldn't recommend that for a lot of rosacea patients. And then also on top of it, it just didn't help with the deeper scars right there. It could stimulate some collagen, but it's not going to be enough really for vast majority of patients. It's not going to be enough. So I would say, if you don't have much money, like you want to do something in a pinch, you could try potentially do microneedling. Although I had a patient today, he came in today because actually he may be on here. Sometimes he's on. And he was talking last week or so about how he was going to come in for a nose scar. And he told me today that he got the nose scar because he was microneedling and he was trying to really help with his deep ice pick scars. And instead it caused a keloid. So he's an African patient, and he did microneedling, and it actually caused a keloid when he did microneedling. And that was obviously much more distressing for him, and was really, really difficult for him because it was like in a spot that's just like very obvious for him. And he was like, really, really emotional about it, because it was like everything was normal and he was just blaming himself for it. And it was like part of what I was talking about just last week. And, I was telling him again that we really have to forgive ourselves for a lot of these things. Like sometimes people do pick, sometimes maybe they went a little aggressive with certain treatments, things like that on themselves. And it's like, I wish you'd maybe, we could go back in time, but we can't. And so it's like we just have to move on and look at things and say, at least there's options here to work on it and improve it. And, something happened, and we just have to really just look at and think in terms of that. At least we live in a time when we could continue to improve these things. And we can't just sit there and be depressed anymore about this, because it's like, it's actually, I should say now, it's more than depression. It's really this guilt that people get. People really do sometimes feel guilty when they have acne or they have scars. And I hope I could not just solve the scars for patients, but also just that feeling of guilt that they messed up themselves. How many procedures were done to achieve the result? This was a few different procedures, but we did about 4 lasers with TCA Cross. I also did some Bellafill for the patient. Also did a little bit of subcision in some spots at one point as well. And then also did XLV laser, and she did it several times with XLV laser. And that's basically for the redness, for the rosacea. So a few different things all at one time, not just one treatment for this patient. Laser Genesis. No, this is not with Laser Genesis. This was with actually, I don't really agree with Laser Genesis. I think that it's not going to help vast majority of scarring. Really, it's going to mildly for a little bit of collagen stimulation, maybe. It's like, you do 1064 or 532 wavelength, which 1064, could give you a little bit of collagen stimulation, like laser toning portion of things. And then the 532 could potentially help a little bit with redness, but it's not going to help so much more than that. Let's see. The Lily Rose is saying, "My man, you need helix laser." Is that what you're saying? I'm not sure what you were trying to say with that. For what kind of scars are you referring to? For it's not really about the laser really at all. It's really not. Is there? Okay, where is that? There's a lot of questions here. How do I get rid of closed comedones and red scars? Let's see here. How do I get rid of closed comedones and red scars? So mostly you want to control oil production. So the biggest way to control oil production is actually, initially you could just try some sort of topical retinoid, like especially if you just have a little bit of closed comedones, like you just pick up something like over the counter, like Differin. That could actually work out pretty well. But beyond that, sometimes for actually, like you were talking about, for scars, you likely are going to need to actually do more treatments, like more invasive procedures, like I'm talking about over here, which is like TCA Cross potentially, lasers potentially. It just depends on what kind of scars there are and the depth of the scars. Sometimes you see a little bit of these scars, like the diameter of it shrinks when you do something like tretinoin or a retinoid. It does shrink. So that appearance looks a little bit better for especially like ice pick scars, or sometimes little Boxcar scars. It softens up a little bit there, but it's not going to really solve the scars like completely as much as you may expect, especially, if you're looking for something that like you have deeper, thick scars like this, and you're expecting that it's just going to be like the significant improvement that you get afterwards is not quite going to get you there. Do chemical peels, CO2 laser cause the skin to age more rapidly? Well, it depends on how it's done. It's possible that if the person's doing it too aggressively, or they're doing, really high heat and they're causing more scarring, things like that, those could potentially cause new scars. They could cause pigmentation issues. So that could potentially be an issue. But by itself, no, you're doing that. I do it every 6 months or so on my own face. It's amazing. I think that you basically have to take a look and see how they're doing it, what kind of skin type you have, what you're really trying to achieve, and like as long as it fits that, we could do that. Isabel saying, I was left with CO2 laser grid scars. Will it go away? What can I do? How far after a treatment are you? Because a lot of times that could be the case for a few weeks, but they do actually end up softening up. Sometimes the best thing to do is actually controlling oil production, things like tretinoin. It could be an idea. And then also, of course, that also soften up some of that scarring right there as well. Silicone tape is also something that actually helps as well. Silicone tape. So you can actually use silicone tape over there, and that could potentially be a way to help out as well. But it's tough to say without seeing you there. Patty Ann is saying, let's see here, where is that? Do you have a recommendation for decreasing double chin Kybella versus CoolSculpting? Well, CoolSculpting, I don't even know if anybody's still doing it. Are people still doing CoolSculpting? I thought that was I thought it was done. I thought people kind of understood it now at this point. And Kybella, really, I'm not sure there's too many people still doing it because as people saw, there was a lot of laxity afterwards. Things that could help though is you could do a little bit of localized tiny little bit of microlipo and then tighten the skin a bit with something like Renuvion, for example, or FaceTite. All those could be options there to tighten skin. Thoughts on fibroblast? I get worried with fibroblast because I have seen a lot of scarring. A lot of times it's recommended for patients who are a darker Fitzpatrick, and you could end up getting severe hyperpigmentation. Even new scarring too sometimes could occur. So I really don't recommend fibroblast for the vast majority of treatments of patients because realistically, actually, we could do better with lasers with minimal, with minimal tissue damage elsewhere. It's very, very controlled. So that's the thing that actually I probably wouldn't really recommend too much with fibroblast patients. What is the procedure? So basically, there's a few different steps for this patient. She wanted to go pretty slow because she just didn't have too much downtime. Usually she told me, and I always ask patients, how much downtime can you give me? And in this case, she usually would give me just like about 3 or 4 days usually. And so we used TCA Cross and erbium laser for most of these treatments. We also did some Bellafill after we did some Subcision as well. And then for the redness, we've been periodically doing XLV to help with that redness. So that actually help with the vessels there. Fun girl saying, oily face, how to decrease it? That's what one of the things is that it's really important, first of all, to double check why are you oily. So one of the best things to do is just double check to see how much milk you're drinking. It's kind of surprising, that milk can affect our skin so much. Because personally, I was told when I was younger that it just wouldn't affect my skin, and it ended up probably in my case because I drink so much milk, it really was something that was a contributing factor for the amount of acne I had, the severity of the acne, the reason why I was on Accutane 3 times, potentially was because of dairy. And over and over and over, I was told that just wouldn't affect it. But clearly that wasn't the case. And we later on learned that dairy does play a big role in oil gland production. And, it would have been nice, if we were told just to make sure not to drink dairy. That would have been an easy thing for me to cut out. Totally unnecessary for me to drink cow milk. What if you don't drink or eat dairy? So also other things to take a look and see, like processed sugar. So other things that, other irritants that could potentially doing things that nutritionally. There's a book by Dr. Leslie Bachman, and she has this book called The Acne Diet. It's a little bit older now at this point, but actually I've been taking tabs of a lot of patients and trying to update things like that myself. And some of the things that she found were actually even like tomatoes were like inflammatory for some patients, which was interesting. So making like this journal and things like that actually ended up helping out for patients to be able to determine things that were triggering the oil. But that's one aspect, of course. Diet is not the end all be all. The second thing is also going to be, of course, hormones. And so for pretty much the vast majority of patients, there's some sort of hormonal fluctuations that are causing acne. In women, it's a little bit easier to kind of pinpoint. You say, well, did this occur during your menstrual period? Is the acne worse? Is there sort of a certain location that's getting a lot worse? A lot of times that's really a standard hormonal. And a lot of women will just tell you on the dot that when my period is about to occur, I'm just going to start getting breakouts along over here. And, what should we do about that? In that case, you could do something like oral birth control, particularly something with like estrogen and progesterone, or you could do something like spironolactone or combined with that. And that's great for women. For men, you gotta double check. A lot of guys, a lot of men are on testosterone these days, like a lot of men. And it turns out like they're trying to work out, things like that. And they're thinking that testosterone is gonna give them this extra boost. And, the consequence of this sometimes is just this issue with their skin. They can have, severe cystic acne sometimes with that. The other problem is that when you have dry skin, you can end up getting dry, really a lot of dryness, and then you overproduce oil to compensate for that. And then when you do that, basically, if there's bacteria on the surface of your skin, that could actually cause you to break out. So things to actually do that you can control is you could use topical retinoids. You could do oral spironolactone, or you could also do estrogen and progesterone combination birth control if you're a woman, of course. And then you could also do oral Accutane or isotretinoin, or you could use the Cure laser. That also works out just well for that. So all different options there for treatment, particularly for oil. What are your thoughts on the VI peel? I like it. It's basically like a modified Jessner's peel, and it makes it really, really simple in a nice packet. So I like it for just like a quick thing for acne, especially. It just like kills that surface bacteria. If you're darker skin type, there's ways of getting it so that you could have added ingredients in there. Again, the best part of my mind about it is that it just makes it really simple for people. So if you're going somewhere for a VI peel, go for it. I don't think it's gonna be a bad idea if you have active acne. Thoughts on spironolactone? Feels like it's temporary solution. Don't want to take this forever. Well, yeah, you basically really are going to have to take something like that for a long, long time. And the reality is that it's basically blocking this excess of this byproduct, I should say, of testosterone. And that byproduct accumulates, and it could cause a few different issues. One is like hair loss even, and then even like excess hair growth elsewhere. And then another problem is that it also could cause oily skin and then acne. For some patients, you may have to be on it for a longer period of time, but what you could also do, if you just only have this oil production issue, you could do something that just normalizes oil glands, and that's something like isotretinoin, or you could do the Cure laser. Either option really now works hand in hand, and it works very, very well. So we now have really enough data to be able to say that it's very comparable to our efficacy for Accutane, which is nice. We have an option that doesn't require oral pills, really. Treatments for rosacea. So first thing, this patient has rosacea too. She was trying many, many things for rosacea. She also did, she did mostly topical creams. Then she also did some lasers for rosacea. But rosacea got much, much better with these treatments. Part of it is I put her on certain creams to control it. Particularly, I tried to get it so that we could do things with anti-inflammatory, with like azelaic acid as like a really, really great product. And then on top of it, you could sometimes, especially if it's like really more inflamed, you could do something like metronidazole could help as well. So I did do that, manage her rosacea a bit, and then also did XLV, which helped out as well. You could do also, that's just like a low dose, like ask your doctor for like a low dose of a tetracycline, like doxycycline. That can actually help out well too. Like that's just like a nice anti-inflammatory, and unfortunately I have to be on it for like really for a long, long time. But it's nice because there's, potentially less chance of antibiotic resistance, less chance of GI flora upset. But it does help with like as an anti-inflammatory for some resistant rosacea patients, especially. Why am I left with red brown dots after halo where the scabbing was? It's been 2 months. What do I do? Well, if it's red and brown, it's like this red-brown mixture. Sometimes what you have to do is do a combination of something that's going to lighten the skin and also something that'll help with some of that the redness itself. One of the best and easiest things to do is over the counter is just a low dose of azelaic acid. So actually just starting out with like 10% azelaic acid could help, and then you could combine that with Eucerin's anti-pigment cream for some of the pigmentation. That's actually not a bad point to start. But if you feel like it's not working out too well, it's not improving enough, then maybe the best option is to come to someone like me for a laser for like potentially like XLV, or if it's really just hyperpigmented, like darker mark, then we may have to do Pico lasers. Those are all the options there. Let's see here. Is there a pattern logic why Boxcar rolling ice pick scars happen, i.e. cystic acne equals Boxcar? No, really, it's not like academic or anything like that, but I do find that a lot of times, especially for men, that I'll find like deeper ice pick scars with men who smoked in the past. I mean, actually, in fact, a lot of times women too. But interestingly enough, there's something about smoking, and then I see a lot more ice pick scars with smoking, like a lot more. And a lot of times you'll ask like history, and maybe they're not actively smoking now or not vaping anymore, but they used to be like vapors or smokers, and it comes out, and you start to wonder. So at some point, it'll be something worth investigating. Or if anybody here is in the medical field, something worth taking a look at to see is there some link with like smoking and ice pick scars. Other than that, it's tough to say if really like a boxcar scar, if a scar is going to turn into a boxcar scar, or if it's going to turn into like a rolling scar, like just definitively, or an ice pick scar. Really difficult to really be able to tell. Chickenpox notoriously makes more like a boxcar scar, but like for acne purposes, tough to really say otherwise. So. Suntum Tam is saying, speaking of chickenpox, Suntum Tam is saying, what do you think about the treatment of chickenpox scar on dark skin? It's tough, really. It is tough because in darker skin types, you can't just like go use a laser and go really aggressive with the laser. So instead, you may have to go inside and undermine the scar a bit with something like a needle or a cannula, do a little bit of subcision, and then you may want to place a spacer, something like Bellafill potentially, and slightly gently soften up the edges of the scar. So for boxcar scars in darker skin types, definitely a trickier process than just traditional, boxcar scars especially. Nancy Arman is saying, Dr. Qazi, I'm diabetic, but it's really controlled. Would I be able to receive your acne treatment? I have severe acne scarring. Yes, if it's controlled, it treats you the same way as any other patient. So there's no problem. I'll be happy to see you. And diabetes, it's like something that obviously you have, but if you're controlling it, like most things are open for you now. So awesome. Good work for you, by the way, doing that. John Jonas is saying, any doctors you recommend in La Quinta? My wife wants to do a facial for acne scars for us. Well, there's very, very few of us in the country, in the world. So I think just kind of take a look. There's very few, so you'll be able to see all of us really. And you could take a look and see, like, compare the work and everything like that, and what makes sense for you. MV Pebblate to say, confirm my appointment after our consult. Awesome. Look forward to seeing you. How much can we expect approximately for the scar treatment, as it's pretty expensive here in New York City? So most patients spend about $5,000 to $7,000 on the scar. It depends on how much volume loss there is. It could take a little bit more, then it could end up costing more. Pujita is saying, what's the best treatment you offer for hyperpigmentation for skin of color? Definitely the Pico laser. That's by far the best option that I could do for skin of color. It's a laser that's really nice because it doesn't overheat the skin. We could do it in darker skin types really well, and then we also can do it even in patients with melasma. So, which is surprising because most lasers you can't do with melasma. The Dermal House is saying, what treatment was used in these photos? So this was over the course of about 2.5 years or so. This patient is we did TCA Cross, we did a little bit of Subcision, we did some Bellafill, we did lasers, especially an erbium laser. She didn't want to have too much downtime. Usually she always tells me about 2 to 4 days of downtime. So I just did, the lighter settings for her generally. But we stimulated collagen production with also through the laser channel holes. I put a dilute form of sculpture on there, which also triggered more of that collagen. So I didn't have to burn the heat and melt it, I should say melt the skin. I was going to say, but that sounds a little bit aggressive. But really, it's like I didn't have to just keep on burning the skin constantly. Instead, I just triggered collagen in each session we did. We maximized each session. Sean is saying, is CO2 laser the most effective treatment for deep ice pick scars? I understand it's a case-by-case basis, but generally, not necessarily. No, I mean, really, you may not even need laser for deep ice pick scars. In fact, 2 of the patients I had today with deep ice pick scars, I did not do lasers on those. So I don't always do laser on them. Let's see here, Vincent, how's it going? Any procedures for post-acne red marks recommendation, please? I saw a few questions like that. The easiest thing to do would be azelaic acid, honestly. Just 10% azelaic acid, easy option. If that's not working, come to someone like myself and we'll help you with like XLV there. PK Farnsworth is saying, thank you for the talk tonight. If some patients need a collagen mask for 24 hours after a big session, what is the experience going home like, and how long until tinted sunscreen be used? Good question. So basically, what we do with our practice is we have a couple different ways of wrapping you up afterwards. If I'm going really aggressive, a lot of times I use like something like a burn mask. Sometimes I also just use a collagen mask. Essentially both of those options are excellent really that's one of the reasons why we get faster results, I think. And also just the recovery process is a lot faster for our patients. So with the collagen mask that we place on, usually it's just for 24 hours. And what we end up doing is that you would just wash it off actually. I'm okay with tinted sunblock as long as it's just a physical sunblock. I mostly just want a physical sunblock for that first week. That's really just what I just recommend. Just a physical sunblock for that first week. So nothing else is possibly irritating for the skin. How do you feel about microneedling skin pens at home? So I was talking about that earlier. A patient of mine, and he's on the live right now on a different channel. He came in because he was microneedling for an ice pick scar. And when he did that, he ended up going, well, potentially a little bit too aggressively. He's African skin type, and it caused a keloid. So it's not that is going to happen, but like at home microneedling, a little bit risky by itself. And then on top of it, it's not going to be too helpful, especially like these ice pick scars. Sometimes it could actually just make the scars go wider. So that's another problem. So I don't really recommend it. Hi, Dr. Qazi. What do you think of Clear and Brilliant for scars? Well, it's definitely not something that I would push for scars at all. Really, I've never had any patient that's been loving Clear and Brilliant for scars. In fact, the vast majority of patients would say that it was not helpful for them for their scars. I wish it wasn't pushed. One of my patients today, in fact, he was saying that he had done 10 sessions of Clear and Brilliant. Someone sold him 10 sessions of Clear and Brilliant and did almost nothing for his scars. He also did 8 sessions of Fraxel laser and it did almost nothing for his scars. And really, actually, he just had a lot of volume loss. Just a lot of volume loss. And so it's like, I'm not sure why they were pushing multiple sessions of Clear and Brilliant. And look in the chat, Melly Elephant is saying, I did Clear and Brilliant, did absolutely nothing. Thank you for informing us, and I hear a lot about that. Gabby's asking, which doctor in New York do you recommend for TCA Cross and Subcision? My dermatologist only offers CO2. Well, I don't really know much about New York because most of my patients do come from the East Coast, and they've tried a lot of doctors over in New York, and they haven't really said that they were satisfied enough with it. So I'm not sure if there's people that are out there that are really doing TCA and Subcision over there at a very high level. I'm not sure, but it's possible someone's sitting over there that has made themselves aware to me or something. But I haven't really heard of anybody. And I have a lot of patients from New York, actually, a lot. And I'm fully aware there's a lot of practices over there. There's a lot of things over there, but just because people focus, like, this patient, for example, who did 8 Fraxel lasers and 10 Clear and Brilliants, he went to dermatologists, and it wasn't the appropriate treatment for his scars. So, he's just like, he even said they were trained, like fellowship trained and things like that, and lasers and things like that. Some of these guys, but it wasn't the right treatments for these scars. And the truth is that nobody's taught Subcision. I don't think anybody understands this. No, you're not taught Subcision in dermatology residency. You're not taught Subcision in dermatology residency. Even TCA Cross. I mean, the TCA Cross, I'm not sure. Maybe there's 1 or 2 people that are taught that. But like, I would just say Subcision, the way that they are taught, maybe like localized spots, like a little bit. I should clarify, because a whole bunch of people say that, we were taught like something like localized spots. But it's certainly not the way that it needs to be done for a lot of these deep rolling scars. And I can see that a lot of times that it's just not effective. And many, many times I have patients that sometimes have done 10 Subcision sessions elsewhere, 6 sometimes to 10 sessions. And it's like, you go in there, you break up so much scar tissue. And it's really interesting. Like, you just go in there and you break it up. And it's like, I'm not sure what they were doing. Go in there again with me and see it. And you'll see that there's it's smooth. And at the end of my session, you'll see that it's like very, very smooth. Everybody sees that, every patient. Today I had a patient, and actually I got really late for some patients at the end of the afternoon because I was working on it. It was very, very tight, thick scars, and I had to break up some of that scar tissue. And I was just like, kept on working on it, kept on working on it. Got it released. We did it. But it did take a little bit of time. It took a lot of effort to do that. And I don't know too many people who are that patient, to be honest with you, when they're doing it, and that focused when they're doing things. And I think you could watch a lot of people and you can see it, that they're not that focused. They're not that patient. And you'll see that some people, when they're saying that they're doing subcision, they're doing like really haphazardly. I've had patients that were told, well, I went to a dermatologist who says he does scars, and he said that I'm not a candidate for subcision, and they have like deep rolling scars. And, I know multiple times that same dermatologist says that, and I wish he just, would say that he doesn't do subcision because he's not comfortable with it, wasn't trained in it, not good enough at it, whatever reason is, and maybe go to someone else or something like that for it, instead of just kind of saying, no, you don't need subcision. It sort of reminds me of like when I had like a herniated disc and I was a high school student, and I went to go to the an orthopedic surgeon who like my dad knew actually, and I was like, hey, what should we do about this? And he's like, nothing really, it's not surgical, blah blah blah, but why don't we do these injections in your back? And it's like, okay, let's go and give these injections a shot. Do it, and it turns out that like we now have all this data that showcases that it's a sham, that none of those things actually were effective. And I probably would have been better served if I had gone to somebody else that like knew how to like work on, that kind of, my kind of herniated disc, or like was specialized in it better. And instead he handed me over to his wife, who was actually doing these injections, which I didn't know at the time, actually. I didn't realize that was his wife. But yeah, it's crazy actually that like, there's that kind of conflict of interest. And what's especially interesting to me, this is like somebody that like my dad had recommended, because my dad's a cardiologist and like they work together and everything like that. And it's like, I still got like scammed by that basically. It's a sham procedure. So like sometimes people like really do that, and it's unfortunate, because like even me in the medical world, my dad's a physician, I still got like tricked by a physician, and like he handed me over to his wife for like a sham procedure that did nothing for my back. And it was like, I ended up fixing my back myself with my own, just working on it myself first of all, physical therapy, and then constantly fixing on it and just fixing it myself. But like, man, I wish I never did that. What procedure did the person shown have? So she did TCA Cross, erbium, a little bit of subcision, and then we also did some Bellafill. So we did a few different things actually right there. Do you agree that cysteamine acid and Mela B3 is excellent for hyperpigmentation? It depends on what kind it is. It depends. Gabby's saying, do you have any prices anywhere? Yeah, so you actually just go to my website. Just go to drqazi.com. Almost all of our prices are right there, actually. So almost all of it. So you take a look at that. Let's see here. What do I think about Banish? So I don't mind stamping devices in general. I think stamping is actually a good idea compared to rolling devices, like things that cause friction. But I just don't think that's going to help much for a vast majority of these kind of thicker scars. Maybe like milder scars, it could help a little bit of collagen stimulation for those ones. But for like these deeper, thicker ones, tough to be able to say that it could be. So someone's asking about affordable acne scar treatments. Try Banish, give it a shot. But it's it depends on how deep and thick your scars are. And for me, one of the more affordable things could end up being something like TCA Cross. That could be an affordable thing for ice pick scars. Hi Amanda, how's it going? Amanda's saying that I have chickenpox scars. I can't find a single provider here in the South that can treat my scars. I've heard that a lot, but in fact, there's not really many people in the world that do. Clear and Perliant didn't do anything for my texture, scars, or pigmentation. So glad that I did not purchase a package of treatments. And why is it always in a package when you actually look at it? Why is it like that? Right? Like, why are they always doing these Clear and Brilliant things in a package, or any of these scar things in a package? Have you ever wondered that? Why do they always do scar treatments in a package? It's kind of interesting, right? Like the same thing over and over and over again. I think it's kind of interesting. I think it's worth like asking, like, why is it that there's a package? And they say, well, you just need more than one sessions. But like, how about the fact that there's so many patients that do 10 sessions, that do 12 sessions. One patient actually did 20 sessions one time, and it just didn't work. I mean, clearly just doing the same thing over and over and over again hasn't improved it. So maybe come up with a better treatment option, or don't try to sell the package and like send it over to your private equity partners and that you sold this many packages today. Sam is saying, hi doctor, do all your patients have to be on Accutane in order to receive your treatments? No, not all of them do. Most patients are not on that. Most patients have it under control, but yes, I do have a lot of patients that I would place on it, like a low dose of it, or we do the cure lasers. So I do want to control oil production. And pretty, I really try to be pretty strict about that. I want to make sure that you get that excellent result. And one of the big keys is to control the oil. Really, really big key. Hi, David. How's it going? David is asking about a Phenol peel dermabrasion. Can it treat tethered rolling scars? Really, really good question, actually. So David is asking, can a Phenol peel or dermabrasion treat tethered rolling scars? Really, it depends on the depth of the scar. I guess if it's relatively superficial, maybe you could have some mild breaking of like those little tether bonds. But I actually literally just did a patient who did a Phenol peel 7 months ago, and she flew in from the Bay Area, and an Asian female patient, and there was so much scar tissue inside there. In fact, she had actually done subcision as well. I believe she did 3 times subcision. I can't remember offhand, but she did like this, like this combination of 3 sessions or something like that. And the practice like usually combines like a few different things all at one session. And then she ended up doing like the Phenol peel, and there was so much scar tissue in there. I broke out that scar tissue. It was like shocking to her that there's so much scar tissue. So she did Phenol, and she had so much scarring still, and that's why she came to me now to go and work on her some more. And there was still so much scar tissue. So in fact, if they had done proper subcision before, and that's something I see over and over and over again, where people don't do proper subcision first, and then you kind of run into problems down the line, because now that you didn't do the first step, like the most important step for rolling scars, that subcision part, then it's really difficult now to mask that with other sorts of treatments. You never really get satisfaction, because you still will see like this bond that's pulling down. You'll still see like these big indentations, and you can't even now start giving volume, because if you put volume in that pocket, it's just going to go around the scarring, going around the tether bond area. So definitely, like, that's why I paid so much attention to like this particular patient that I had today, who I just worked on each individual scar like just over and over and over to make sure that we got that really, really well. It was really tight, because I knew that we had to do some volume also too. And it's like, I got to make sure that it's going to go and look really beautiful eventually. It's like, it takes work, it takes effort. And my point is, a lot of times I just don't see too many people to put as much effort in their work. That's sometimes what I think. Do certain ethnicities respond better to treatments? Yes, they do. It's more that it's faster, I would say. It's not that it's like just better, like all around better, but I would say it's faster. Like sometimes it really is amazing to me that I could get like amazing results faster in Korean women, really. It's like something that would take, 9 months or a year later. I can see that sometimes in like 4 months in Korean women. And it's pretty cool, a lot of times. So it's like, and I like that. And the good thing, a lot of my Asian patients are, a lot of my patients are actual Korean women also. So it's like, it helps me out, because it's like, I got really high satisfaction and got faster results like that. So, but there's a few things I think there's, that you could control. Of course, you can't control your ethnicity, but there's things that you could control, which are just going to be oil production, it's going to be sun exposure. And I think part of the reason why they're so good is because they're so good with sun exposure. They've like a lot of most of my Korean patients are very, very good with sun exposure, making sure that they're constantly wearing a lot of sunblock too. There's a lot of different possibilities though. Is it, do I see it as often in Korean men? It's like somewhat, but like, it's more like, it's like faster in Korean women. Like they're satisfied, I'm satisfied, like really a lot faster. And it's like, okay, awesome. Like you do the same thing now on someone else, and it could take maybe like 9 months or so. So interesting enough. Could it be their diet? Could it be the kimchi? I don't know. I'm not sure, but because I'm not sure. I think there's multiple different possibilities. I think, like I said, sun exposure is another reason why. Let's see here. Is this patient's scarring considered mild, moderate, or moderate severe? That's a good question, actually. Really good question. So it's actually a bit of a trick question in a way, because she's somebody who is Fitzpatrick. Even though she looks light over here, she's actually has mixed ethnicity. I don't want to say it because it's such a unique ethnicity, and she does want to keep stay anonymous, but she is Fitzpatrick 4 actually, even though she looks lighter over here, and she has a little bit of melasma there. She has some redness over there, so it's a bit complicated because of that. But the scarring itself, I would classify as more mild to moderate actually. It's just that it's like kind of tightly compacted in certain areas, like a little bit stronger in like areas that are particularly trickier too, like around the nasal labial fold, and so it's even though it's more mild to moderate, it's like still tricky kind of type of work to do that. Do you notice vastly different results in younger patients versus older patients? It's not about the ultimate of the ultimate outcome. It's just about the speed of the recovery, the speed of that collagen response. I would say that I think ultimately they do get really great improvements. I had someone who was in their 80s, actually, amazing skin after a little while, but I think it was probably like 3 months or so. It was already looking good. I just saw him now, maybe like a month ago or so. It was about a year afterwards. And he looks even better now. So it's like, we ultimately get there. It's just sometimes it could take a little bit longer, and the recovery process could take a little bit longer as well. He actually did it right before Halloween one year, and he had like the burn mask on and everything like that. And he's just like, everyone like thought he was like wearing like a Halloween thing. So I thought, I was like, just play along with it. It's like, no, I'm not going to talk to anybody right now. I thought I would look like like a mess. And I was like, it's Halloween. It's okay. Just like you had a burn mask on. It's okay. But he looked good at it ultimately. Is a phenol peel safe for dark skin type? Really Fitzpatrick 1 through 4. Just do Fitzpatrick 1 through 4 for that. And it has to be really like deep, thick, really deep scars typically. Or you could say like those thick edges of the scar. That's really what it's typically about. How painful is this? It's not painful. We numb you up. We do injection nerve blocks. I have so many different ways of numbing. So if it's a little bit painful, I'll just keep on checking, and I'll just keep on putting more numbing solution there if we could. Just keep on doing that. Gabby's saying, does subcision put you at risk for worse scarring? I have pale skin. Well, it could if it's not done properly. I've had a person that had a little bit of scarring because somebody did it over in Beverly Hills with them, and they were, I think they do a dry subcision or something like this, or actually no, they probably use like their own tool for this. I think is that the case, and they went like scraped underneath there, and like they caused it to get hypertrophic underneath there. But like with my patients, no, it's like there's a way to do this. I put a lot of numbing solution in there, so it glides in really well, break it up really well. And there's a way to do it. It's just really meticulous and really carefully, especially around certain areas. It's just like sometimes you just have to localize and select some spots there. Is it possible that I need multiple subcision sessions for rolling scars to improve? It's possible. Yeah, it is possible, especially in the lower part of the face. You may need a couple times of doing subcision, but you most likely need a little bit of volume in there. So something like Bellafill could help out as well. Accutane or spironolactone for oil control? Well, it depends on how much oil is going on, and also if you have like moderate to severe acne. If you have moderate to severe cystic acne, you really should consider more like Accutane, and then also really take that seriously so we can avoid scars like this. That's the goal. Appreciate you, Beezus. Thank you so much. Thank you guys for all the good comments. I saw a bunch of patients that were on here earlier and I missed them. But if you're still on here, thank you so much, by the way, for coming on and saying nice things. Always appreciate seeing you guys too. At some point, you guys should tell me when you come in that was you, because I always like that too, to know what the screen name was. Osmani Hernandez is saying, hello, doctor. I have an online consultation with you tomorrow. Is there anything I could do beforehand to make the most of our time? Yeah, good question. So whenever you make an online consultation, you could do that through our website, drqazi.com, and super simple. Then my staff will reach out to you, set it up, and they'll show you, basically, they'll send you some instructions on how to take some photos. You just basically take a few angles for your face. And then in terms of the video consultation, make sure there's no filter on for Zoom or anything like that. And then also, if you could potentially have like a light source near you. Sometimes I try to use like a light, like either a cell phone or if there's other kinds of lamp, or like if you're near a window, I'll have you like stand by the window. And then I'll use that kind of angled lighting to help with like, especially for like more dynamic movements to see if like the rolling scars, the depth of the scars, things like that. I'm able to determine a lot of that based on that. So I'll look forward to seeing you, Osmani. So you never recommend TCA Cross on dark skin? No, I do TCA Cross all the time on dark skin. In fact, I did a patient yesterday on Fitzpatrick 6 on dark skin. So African patient, I do it all the time. It's just a way to do it. I would be happy to help you. I appreciate all the questions, guys. I will be happy to help you out tomorrow. I'll be back on here tomorrow. We have the rest of this week, so we'll hit some more questions, a lot of things. If you want to come in early at 9 p.m., I'll be happy to help you, especially these questions that were kind of like you guys asked a few times. I'll try to circle